can come afresh, and then you may be healed of whatever situation you went in. Unlike that, the nervous system or your brain is quite a delicate. Screen I'm sure how about no. In a way, it is called Bekui. You know, they call Akweteshi Ekponha. Drink for the poor man. Okay. Thank you, brothers. Now, with the neurodegenerative, the nerves, that one, when your brain cells die, you may not get them back to life. So, for example, in orthodox medicine, when a patient's heart decides to stop beating, the main aim is that any of the body parts, even when they are deprived of oxygen for a while and they die, it's quite easy for them to be repaired or regenerate as time goes on. But with the brain cells, when they are deprived of oxygen for about 8 to 10 minutes, if you don't take care and they die, that will be all to it. Your best case scenario is to use other parts of your brain, to train other parts of your brain to do that thing. If you want to understand what I'm trying to say, you see, every day you've been brushing your teeth with your dominant hand. Now interchange it. Try brushing your teeth with the less dominant hand. You see how difficult it is. You have to train the other part of the brain. The body is like the brain cells, some of the nerve systems helps in this ipsilateral and contralateral kind of principles. It's like the right part of the brain is controlling the left part of the body and vice versa. Huh. So when a person has stroke, it's as if say is the right if the right part of the brain is what is having the issue, then you mostly see the weaknesses on the left part of the patient. So when you go and meet a CPR situation, a situation where a patient is not having a pulse, the heart is not pumping, and it's been quite some few minutes, like let's say 1 to 8 minutes, then it means that the brain cells are active. You can actually manually push the heart to eject blood from it. That is what we call the cardiopulmonary resuscitation, manual chest compressions. You are pushing your blood because you want to keep the brain cells active. It's the whole idea. So sometimes somebody can be dead, but clinical death in some perspective. For example, I was once on a debate panel and I was debating that there have been instances people were dead and then maybe doctors pronounced them dead. They took them to mortuary and then you could see that they were coming back to life. In all honesty, taking religious lens aside, it was a misdiagnosis, or there were some sort of activities in the brain so little for even an electromagnetic device to detect them. That is why we thought probably the person was gone. So sometimes when there is a little bit of rekindling and the nerves decide to maybe spike or generate impulses, the person can be brought back to life because there are nodes in your heart. The sinoatrial node is a natural pacemaker. If your nervous system is working well, it can just pump back into life. It does happen. But when we pronounce you dead, clinical death, proper death, I'm telling you, nothing can bring you back. Nothing on earth will bring you back. If you have prophets who can bring people back, there is a very close mortuary at Kolebu. Some people died not so long ago. We can give them to him or her. And then there have been claims, but in reality, sometimes some of these claims, there is a different explanation to them. The dementia type of psychotic patient is the one who is aging, said that the nerves are just dying out and they are not coming back. So any condition, you can even describe stroke as a neurodegenerative kind of condition. You now have to train a different part of the brain. That's why such individuals need what we call rehabilitation or occupational therapists to just teach them to use the body part again. Sometimes they are able to get close to their natural state. But in most cases, if you really knew them before, you can see that there's still a little bit of a defect in how they use their bodies, unless there was no massive damage in the brain. So the neurodegenerative one, I want you to think of any condition, any one like the Parkinson's, the what else can you think of? Another one starts with A. A neurodegenerative.
Alzheimer's.
Those are proper neurodegenerative conditions. The nerves are dying out and they will not come back. It's you bought an old car You bought a car. The engine that you are using it today wouldn't be the same engine